Hello, everybody. This is a re-recording of the second lecture for Kinesiology 376. Um, one of your classmates mentioned they couldn't hear the audio, so I am re-recording it. I'm using a little bit different of a file system, so hopefully that will clear it up a bit. I've also placed another video um, in the first section on Canvas showing you guys how to view these PowerPoints, because if you're trying to view them straight off of Canvas, sometimes they won't work. If you're using a Mac, sometimes Mac doesn't like to do this stuff. So what you need to do to actually watch these videos is you have to download them, which if you're hearing my voice, you've already done this. But just to recap, you have to download them and then open up the slideshow, and then it should automatically play and you should hear me talking and see the animations. Also, as we're kind of going through this, is there's animations in this thing too, in the actual PowerPoints themselves. If you're not seeing the animations as far as the text appearing, especially for any sort of math stuff, is try to hit the right directional key on your keyboard, and they should show up as well. Okay, so let's try this again. So for this second lecture, we're going to be talking about some kinematic concepts for analyzing human movement. I'm going to provide some examples of what linear and angular movement are. And basically, when we combine linear and angular movement, we have general movement or general motion. We're also going to look at our reference positions from the anatomical reference position and our three planes and axes associated with the human body. And then we'll look at some directional terms for joint movement terminology. But first, let's talk about how to plan and conduct qualitative human movement analysis. There is another presentation where we go a little bit into detail, but we'll kind of touch a little bit on that as well. So when we say movement analysis, we have two types of looking at this. We can either look at it through a quantitative way or a qualitative way. So analysis of human movement can be either quantitative or qualitative. When we say qualitative, we're describing the motion using measures and quantities. So we involve the use of numbers. For example, we could say somebody jumped 2.2 meters, or somebody ran 4.5 meters per second with a toe clearance of 0.8 centimeters. We're using numbers and measurements to describe this motion. We can also look at motion through a qualitative lens, and we're involving non-numeric descriptions of this movement. Okay, we're just describing the quality of movement. For example, is for a qualitative movement, we can say instead of him jumping, what did I say, 2.2 meters, I could say he jumped a short distance. Instead of she ran 4.5 kilometers per second or meters per second, she ran slowly. He almost tripped over the obstacle. I'm not using numbers. I'm just describing the quality of that movement. So biomechanical analysis includes both quantitative and qualitative descriptions. But biomechanical research relies heavily on quantitative techniques. In the Veer Lab, we use motion capture and force platforms to measure quantitative data. And we're using that because we're looking at a specific, very specific question we're trying to answer. And the only way we can answer that is through math. And we need numbers for that. However, when we look at the clinical setting, the athletic setting, people regularly use qualitative techniques. And this is because if they're trying to do rehabilitation or trying to teach an athlete a new skill, telling them simply to rotate their arm at 15 degrees per second isn't really going to help them. So they'd say, well, I need you to rotate your arm quicker, or I need you to press against me harder, stuff like that. So if we're trying to describe this to somebody to get them to mimic a movement, we would use a qualitative technique. But qualitative does not mean general. So when I say general, is we develop general questions, and we're trying to use those general questions to guide us to a more specific question. So a general question may be, is the movement being performed with adequate force? Or why is the shot putter not getting more distance? We ask ourselves these questions first, and then we try to look at and collect some data simply through observation, and hopefully that can guide us to more specific questions. So these specific questions may be, is there excessive pronation taking place during the stance phase of the gait? That could possibly lead to a greater risk of eversion sprains at the ankle. Is the release of the ball taking place at the instant of full elbow extension? So then after we've made some observation with our general questions, we then go into our more specific questions, and then we collect more data, okay? So qualitative descriptions can be general or very detailed, okay? A general description was the man walked down the street. More specifically, we could say the man walked very slowly, leaning to the left, and was bearing weight on the left leg for only as shortest time as possible. We can, with that specific question, then we can start possibly making some judgments as to why that's occurring. Maybe he hurt his leg. Maybe he's drunk. We don't know. So when we look at our movement analysis, at least under the qualitative guise, first we develop our questions about the movement. Generally, we start with a general question and move to a more specific question. Then we collect our data. For qualitative data, we're looking at just general observations, either through videotape or just us having multiple observers look at the movement. Then we attempt to answer those questions and then develop more specific questions that can help us in rehabilitation or movement learning. So what skills are necessary and what procedures are used for effective analysis of human movement kinetics? There's a lot of skills and a lot of procedures we use. We use multiple observers, we use different skill training techniques, but before we can do any of that, we have to understand the terminology of biomechanics. This is needed in order to communicate specific information about human movement. We need to know the terminology that precisely identifies body positions and directions. This is also, we need it because we need a common language to speak with other biomechanists and scientists. If we're writing manuscripts or we're presenting at a conference, we try to use the same language as everybody else so that, when we're explaining something, we don't actually have to define every single term we use. So when we start looking at our language, especially directional language, whether something is flexing or extending, what plane it's occurring in, we base it off of a starting point. The starting point is the anatomical reference position. In this position, we're saying the person is standing erect or standing upright with their feet slightly separated. Usually we say their feet are shoulder width apart. So if we look at where his feet are, they tend to line up with his shoulders. His arms are hanging at his sides and his palms are facing forward. We consider this a starting point for our movements, especially for movements of different segments, okay? So whenever we're saying something is flexing, it's flexing from this point. If it's in extension, it's in extension from this starting point. We also have some terms that we use for position of certain joints, other segments, limbs, features of the body. We generally say something is superior if it is closer to the head than another object or segment of the body. So the shoulder is superior to the hip. The opposite of that is inferior. Something is inferior if it's farther away from the head. So we can say the knee is inferior to the hip. The knee is closer to the head than the hip. Something is anterior if it's towards the front of the body. The nose is anterior to the ears. Your belly button is anterior to your lower back. It's closer to the front of the body than your lower back, obviously, hopefully, at least in the anatomical position. And then the opposite of anterior is posterior. Posterior means that the body segment or feature we're looking at is towards the back of the body. So the spine is posterior to your belly button. And then we also have a few more terms that we use, especially for the appendicular body, where we're talking about your hands, arms, legs, and feet. Something is medial if it's closer towards the midline of the body. If you were to draw a line from your nose to your belly button, that's the midline of your body. So we could say that your nose is medial to your eyes, or once again, at least hopefully it is. The opposite of medial is lateral. Something is lateral if it's away from the midline of the body. Furthermore, we have some distance terms. Something is proximal if it's closer to the trunk of the body. So your pelvis is proximal to your knee. Your pelvis is actually part of the trunk, so it's closer to the trunk than your knees. The opposite of this is distal. It's further away from the trunk. Then finally, our last two terms is superficial and deep. Something is superficial if it's towards the surface of the body, and it's deep if it's inside the body or further from the surface of the body. So we know these terms, but we also want to use reference planes as well. Our anatomical reference planes are three imaginary cardinal planes, just like you have cardinal directions, north, east, south, west. But we have three imaginary cardinal planes that bisect the body in 3 dimensions. The first one is the sagittal plane. You also hear people refer to it as the anterior-posterior plane. This divides the body vertically into left and right halves. So when we look at any sort of forward or backward movement, such as walking forwards or backwards, we say the movement is occurring within this plane. So we see this plane here, okay? When the person's walking forwards or backwards, it's occurring within this plane, okay? That's what we're looking at. It's occurring within a plane, okay? Now that's our sagittal plane. That's our forward and backward movement. We have our frontal plane, or sometimes you'll hear coronal plane, which splits the body vertically into front and back halves, so our anterior and posterior halves. And this is where we see lateral movement occur. So if you're doing a jumping jack, you're moving within the frontal plane. If you're bending sideways, you're moving within the frontal plane. And then finally, we have the transverse plane or horizontal plane. This divides the body into top and bottom halves right here. So for this type of movement, we're looking at the rotation of a segment or body or system, okay? If you are just kind of spinning in circles, you're sitting in an office chair just kind of doing circles, you are doing that within the transverse plane, okay? So any sort of spinning is within the transverse plane. Now, a small note is we have 3 planes, but a lot of movement takes place in more than one plane at a time. If you reach out to then scratch your opposite shoulder, you're moving within the sagittal and frontal plane because you have to do flexion of your shoulder and then kind of lateral abduction or adduction of your arm. And we'll get into that in a bit. If movement occurs in more than one plane, so if movement occurs in more than one plane, it equals oblique. Okay? You'll see this in some text. Other times authors will combine sagittal, frontal, and transverse into one word, but we're simply saying that's occurring within an oblique plane. A lot of times, though, if you say it's occurring in an oblique plane, you should be able to say what planes are making up that oblique plane. Okay? So we have our three planes, and motion occurs within these three planes. But we also say that a segment of the body or a segment of the system or a limb of the body the motion occurs around an axis. So when you flex your arm at your elbow joint, it's occurring within the sagittal plane, but around an axis. So think of it like this, is if you are looking at the wheels of a car as it's moving forward, those wheels are moving within a plane, but they are rotating around a central axis, the axle of, and these axes match up to their specific planes. So we have the longitudinal axis or vertical axis. This is within the transverse plane. So an example of this is a pirouette. If this person is spinning in a circle, okay, they are doing this pirouette within the transverse plane and around the vertical axis. For our frontal plane, we have the anterior-posterior axis, okay? If you're doing a cartwheel or you're doing your jumping jacks, your limbs and body are moving within the frontal plane, but around the anterior-posterior axis. It'd be like maybe like right about where your belly button is, okay? And then for our sagittal planes, our flexions, extension, our forward, backward movement, that occurs within our sagittal plane, but around that medial lateral axis. So the axis would be kind of projected through the body like that. Example would be a somersault. Once again, if you're doing an arm curl, your forearm is moving within the sagittal plane around the medial lateral axis, which would be perpendicular to your elbow joint. So, our forms of motion. Most human movement is what we consider to be general motion. It is a combination of both linear and angular motion components. We say something is linear if the system is moving in a straight line. All the segments within a system are moving in the same direction. It is angular if we see rotation of a segment, where not all parts of a segment or parts of a system are moving in the same direction or at the same speed or velocity. So for an example, you're walking in a straight line, you're performing linear motion, but you're accomplishing that through the rotation of your limbs at your joints, which is your angular motion. So you're walking in a straight line, which is our linear motion, but that's accomplished by angular motion of your limbs. So there are two types of linear motion, okay? Once again, linear motion is motion along a line. So for linear motion, we have rectilinear motion and curvilinear motion. Rectilinear motion is motion along a straight line. Curvilinear motion is motion along a curved line. Curvilinear motion is not rotation or angular motion because all of the body is moving in the same direction at essentially the same speed, okay? Angular motion is rotation around a central imaginary line, which is also called our axis of rotation. So our our medial lateral axis, our vertical axis, our anterior posterior axis, that is where the rotation is occurring about, okay? So we see this gymnast, she's rotating around this central point right here, and her body is rotating about or around that axis. Okay? So, in biomechanics, we're looking at we're essentially trying to look at the human body as through a mechanical system. So a system is a body or group of bodies to be examined. Okay? This is, if we're looking at people, the human body is a system. In our case, the body segments, our limbs and trunk, head, and neck, make up that system. Sometimes we're interested in the entire body. Other times we're only interested in certain segments. It's dependent on our questions. We'd be interested in the entire body if we're looking at a qualitative analysis, trying to measure, well, we can look at it quantitatively too. We're looking at the speed or velocity of that body. But if we're looking more specifically and we're trying to figure out, are they fully extending or flexing their thighs while they're running? We're looking at just the segment, okay? So for example, if a patient is experiencing multiple falls, we start by looking at the entire body, but then we may look at other segments of their body. If we are considering improving the trajectory of a ball that's thrown, we would focus on only the throwing arm. So we're looking at just the throwing arm segment of the entire system. So let's talk a little bit about sagittal plane movements. In layman's terms, flexion is sagittal plane movement which brings two body segments closer together in the direction we expect them to move. This is correct, but I prefer kind of the textbook sort of definition in which flexion is the anteriorly directed sagittal plane motion or rotation of the head, trunk, upper arm, forearm, hand, and hip. Those, when they move forward within the sagittal plane, that is flexion within the sagittal plane around the mediolateral axis. However, when we go below the hip, we're looking at posteriorly directed sagittal plane motion, usually of the lower leg, and usually of the lower leg. So here we have hip flexion, which is anterior. We're just seeing a decrease of the angle or anterior motion of the thigh at the hip. And then we have hip flexion, where we're seeing posterior motion of the lower leg, okay, but it's still within the sagittal plane. We're decreasing this angle. So that's our flexion. The opposite of this is extension. In layman's terms, we can just say extension is the opposite to flexion. But we're taking this class officially, so we're not going to use layman's terms. Textbook extension is the movement that returns a body segment to the anatomical position, or upright, palms facing forward, feet shoulder width apart. So extension returns a body segment to the anatomical position from a position of flexion. Okay? So if you raise your arm and you're pointing to the ceiling and you bring your arm down to kind of back to its resting position, you've performed flexion. If you then bring your arm behind your body, that is what we consider to be hyperextension. It is the rotation beyond the anatomical position in the direction opposite to flexion. And then when we're looking at the foot and ankle, we have two new terms, which is dorsiflexion and plantar flexion. This is sagittal rotation at the ankle. Dorsiflexion, you're pointing your toes upwards. In plantar flexion, you're pointing your toes downwards. Okay? So let's look at some examples of these. By the way, these few slides, we're looking at pictures. These look like really cool exam questions. So keep that in mind. So our first picture, he's kind of pointing up to the sky. This is flexion. We consider this shoulder flexion or upper arm flexion. It's occurring at the shoulder joint within our sagittal plane around the mediolateral axis. Then when he pointed, as doing flexion, his arm is going upwards. Then when he brings his arm back down to kind of resting, we consider this to be extension. Once again, within the sagittal plane, around the medial lateral axis. As soon as he starts bringing his arm behind him, okay, this is hyperextension. This is occurring within the sagittal plane around the medial lateral axis. And so here we have our dorsiflexion and plantar flexion. These are both, once again, sagittal plane movements around the medial lateral axis. We consider this to be dorsiflexion because this is the dorsal side of the foot, okay? He's reducing the angle between his shin and the dorsal side of his foot. And then here we have plantar flexion. We call it that, this is the plantar side of his foot, okay? And he's reducing this angle right here, okay? So let's talk about our frontal plane movements. We have abduction and adduction. Abduction is to move a segment away from the midline, okay? If you're doing jumping jacks, when you're bringing your arms upwards, you're abducting your arms. When you're coming down with your jumping jacks and you're bringing your arms closer to your body, you're doing adduction of your arms. I'm saying AB and adduction simply because these two terms, if you say them quick enough, they start to kind of sound similar, and it's very important that they remain opposite of each other, okay? Then for our wrist and hand, we have two terms because we don't use abduction and adduction for that. We say radial deviation, which is kind of a lateral flexion of the hand towards the radius of your forearm, so the thumb side of your forearm. So if you take your hand and you try to flex it towards your wrist on the radial side of your forearm, that is radial deviation. The opposite of that is ulnar deviation. On the little finger side of your hand, if you laterally flex that and bring it closer to your forearm, that is ulnar deviation. However, we do not call radial or ulnar deviation lateral or medial flexion of the hand. This is used only to describe that movement. Please use radial and ulnar deviation. So here we have, let's pretend that he started at anatomical position and he brought his leg to the midline of his body. He is doing adduction. He's adding to. Then, if once again we're starting, he was in anatomical position and he's taking away his leg here, he's doing abduction. He's taking away that leg. And then we have our kind of right and left lateral flexions. So it's important to note that we're looking at this person head on. So this is going to be his right side. This is going to be his left side. Okay? So in this first picture, we see that he's kind of flexing, laterally flexing to his left. So we have left lateral flexion. And then he's doing the opposite in the second picture here. We have right lateral flexion. And then here is our radial and ulnar deviation. Once again, he's doing lateral flexion of his hand right there and there. This is the ulnar. This is where your ulnar bone is. This is where your radial bone is. Okay? These are our frontal plane movements that also occur about the anterior posterior axis. And then for our feet and ankle, this person is pointing the plantar surface of his foot, the bottom of his foot, towards the other side of the foot. So we say this is inversion. He's doing inward rotation of his foot. And then the opposite of that is eversion. He's pointing the plantar surface of his foot away from his other one. So he's doing outward rotation of his foot, but we call it eversion. And then when we look at our transverse plane movements for our head, neck, and trunk, or what we consider to be our axial body, we keep it simple. We say it's left and right rotation. This is occurring within the transverse plane around our vertical axis. For our appendicular system, especially for our forearm, if our palm is facing down, or we rotate so our palm is facing down, we consider this forearm pronation. Once again, transverse plane, vertical axis, okay? And then if you rotate your forearm so that your palms are facing upward, we call this forearm supination. The nice things about these movements is a lot of the muscles that perform them have very apt names. Two of the muscles that perform pronation have pronation in their names, the pronator teres and the pronator quadratus. Then we have a muscle in your forearm that is the perfect name for supination. It does one thing and it does it well. It does supination extremely well. We simply call it the supinator. And transverse plane, vertical axis. Now we have our legs. Remember, this is the leg. This is not the ankle. This is not the knee that we're looking at the rotation. We're looking at the rotation at the hip. Now, when I was an undergrad student, and I was a master's student, I had a professor, and I learned a different term for this. I will try to use the terms for this class, but I may switch back and forth. But you'll hear me say internal rotation for what should be medial rotation. So this is medial rotation. He's pointing his toes towards the other foot. I learned internal rotation, but medial rotation is the correct way. I'll do my best not to switch back and forth, but sometimes that happens. And then the opposite here we see is he's pointing his toes away from his other foot. And this is once again occurring at our hip, okay? This is lateral rotation of the leg. If I mess up, I may say external rotation of the leg. And then kind of our last big thing is we're seeing our transverse plane motion with horizontal arm abduction and horizontal arm adduction, okay? And we can do similar motions at our legs as well, at our hip joint. And then finally, this is our last slide, but many, and I already talked about this a bit, but many of our movements take place in more than one plane, okay? They occur within both the sagittal and frontal, or within both the frontal and transverse. But generally consider any motion that occurs in more than one plane to be an oblique motion. However, though, you should still understand what 2 or 3 planes are making up that oblique plane. And the same thing for the axes, excuse me. And then finally, we're just about done, there is one more special term that we use, and it's called circumduction. You can do circumduction of your fingers and circumduction of your wrist. Circumduction occurs within the sagittal and frontal plane and around the medial lateral and anterior posterior axis, okay? If you're trying to make a circle with your finger or a circle with your wrist, it's called circumduction. It does not occur in the transverse plane. You can't physically rotate your hand at your forearm. You'd have to dislocate your hand, so don't do that. Same thing with your fingers. These are occurring in our sagittal and frontal planes. So I hope this has helped you guys. I hope everything is not too hard to understand. If you have any questions about this, feel free to reach out and email me, and then we can also talk during the weekly office meetings. Goodbye.